Well, a warm welcome to today's talk. It is Friday evening and it's the 6th of August today. Some news from around the world. United States still quite concerning, especially in some southern states. And the news from the UK is looking guardedly optimistic. But let's just look at an orientation slide first of all. A few different countries, and we're going to be doing a bit of a scoot round hopefully today. So Australia, sadly, the cases are coming up. A report from Australia later on. Canada, a drift up there, but relatively low compared to South Africa. Up and down a bit there. Probably can't read too much into those spikes. It's probably at that kind of level there in South Africa. Lower, but still maintaining at a fairly high level. Ireland, United States, France had a big increase recently, so cases are going up in France, but good to see the UK and also Spain starting to go down quite nicely now. So just a bit of orientation there. Now let's go straight on to the United States now. So here we have the daily cases in the States, and of course we see there's a sharp upward trend. And if we look at the deaths in the United States, which I think I got wrong yesterday, so we'll check it today. So daily deaths in the United States. Also, we can see that the last couple of days there's been quite an upward trend there as well. So certainly some things that we're not too happy about in the United States. Now let's have a look at that in a bit more detail now. So the case is actually 137,000, pretty high in the last 24 hours. Highest since February, unfortunately, so cases well up. Florida and Texas accounting for a third of those cases. And White House coronavirus coordinator, Jeff Zients. Florida, Texas, Missouri, Arkansas, Louisiana, Alabama, Mississippi. Half of all new infections, less than a quarter of the population. These are the states with the lowest vaccination levels, and we can see this playing out now exactly as we anticipated. Well, exactly as anyone could have anticipated, really. It was pretty obvious what was happening. Texas, we know hospitalizations up in Florida. Texas also. Hospitalizations have tripled since the end of June. Dallas is on hospital code red. That's the overall deaths for the United States there, so that's gone in the wrong place. But it's 641, which is not good. Hospital admissions and deaths up 40% in 7 days in the United States generally. So those two lots of figures there replying to the states in general. But hospitalizations and problems in Texas with the hospitalization code red. So Florida and Texas, particularly hospitalization pressures. Director Rochelle Walensky, across the board we are seeing increasing cases, hospitalizations in all age groups. Millions of unvaccinated children are returning to school now, so it really is quite inevitable that cases are going to go on rising, I'm afraid, here. So across the board, all age groups increasing. It's a bad situation at the moment. Good news, jump in first vaccine shots. Tennessee, first dose is up by 90% in 2 weeks. Good. And when we say better late than never, it really is better late than never. But it's not going to stop this current wave. It's going to take too long. It's Delta variant. We need 2 doses of the vaccine. We need 3 or 4 weeks between the vaccines, and ideally, of course, that should be 6 weeks, in my view, or even 8 weeks. And then you need 2 or 3 weeks after the second dose. This is not going to kick in quickly. And these are first doses that have increased, remember. But anyway, it's good. It's good that it's happening. Oklahoma up 82%, Georgia up 66%. So they were particularly low vaccine states going up. Most colleges and universities requiring shots for students to return on campus, students and staff. And of course, in the States, anyone over 12 is now being vaccinated. Now, booster doses. It seems like Pfizer definitely is saying booster doses may be needed. Moderna saying booster doses will probably be needed as well. They're not saying they need it now, but they're saying it's probably going to be needed. So both already making rumblings about this before winter. Possible booster in case of Moderna could be a half dose, which would be good if a half dose is supplying the boost that's necessary, and so far that does seem to be the case. Now, Moderna are working on different configurations of their vaccine that are more tweaked to the current variant, so you would expect efficacy there to be very high. But I don't really think the CDC certainly aren't going for third doses now. The UK hasn't made a decision on it about booster doses, and so far from the US data, Moderna maintains 93% efficiency after 6 months, which is maybe a 1% or so down, but basically pretty good. So you can kind of see Pfizer and Moderna there seem to be indicating that second doses might be a good idea. Now, on a completely separate point, just to remind ourselves of something we did a few days ago, Pfizer and Moderna prices for Europe, we believe, were €19.50, which is, I guess, is $21 for a Pfizer shot, and Moderna is £18.30, which I guess is about $25 per shot. So rolling out a third shot to 330 million Americans, work it out for yourself. So the CDC will work on the science. We would believe, we hope will work purely on the science, and they haven't made a decision yet. Dr. Fauci, though, is saying efforts are underway for people with weakened immune systems to get booster shots as soon as possible. Doesn't seem to be happening yet, but he wants that to happen, which of course is fine. I mean, there's nothing new in this. Nothing new in this at all. So, what I've always done in the practices I've worked in, it's if one vaccine didn't work and a patient wasn't producing a response, you just try them with another dose of a different brand of vaccine if there was one available, and see if it works. So there's nothing new in this, nothing surprising. And really, people with immune system compromise, we should be trying to get these people covered because they are at risk. Chile, Germany, France, Israel are already carrying out boosters for certain parts of the population. Now, Novavax, we've looked at this quite a few times over the past year now. Protein-based vaccine with an adjunct. Phase 3 clinical trial data was excellent, and it's been very frustrating that nothing's happened on it yet. Now, apparently what's happened, it's not the efficacy of the vaccine. The difficulty is that Novavax are having difficulty with their logistics and their manufacturing capacity. And they have not, it's taken them a long time to get up to regulatory approval standards in their actual vaccine manufacturing. So this is not a problem with the science of the vaccine. The delay is in the logistics of the manufacturing of the vaccine, which can happen. It's a complicated process. But anyway, filed for emergency authorization in the US yesterday, I believe. 90% efficacy in India, Indonesia, the Philippines. So this looks like it's going to be a good vaccine. And this could well be a good top-up vaccine as well, because it's going to work in a slightly different way by giving the ready-made protein antigen. They've partnered with the Serum Institute of India in Pune so they can make large amounts, hoping for World Health Organization approval in August, United Kingdom approval in September. And they've agreed to supply 1.1 billion doses to low and middle income countries. All good. So quite a lot of grounds for optimism, really, with the Novavax vaccine. As I say, the difficulty has been the manufacturing, not any question mark over the quality of the vaccine or the science. And I believe it's going to be quite a bit cheaper as well, so it would be good to get it going. Now, it doesn't seem a year, but I remember last year we followed the Sturgis motorbike rally quite carefully, and it's starting again today, I think. 700,000 people expected, and of course they come from all over the country. They mix in Sturgis in South Dakota, and then they go back to other parts of the country, and you don't need me to comment on whether that's a good idea or not. Now, moving on to the UK. Now, cases have been a bit higher last couple of days. 31,000 there. 31,808 confirmed cases. So we do see a bit of an upward blip there towards the, if we look on that one, yeah, I think we can see a bit of an upward blip there. Now, what really matters, of course, is how healthcare provision is working, and we do see that admissions to hospital are roughly, they're in the 700s. They've been in the 700s for, this is the third day they've been in the 700s now. A total of 5,631 people in hospital. Not good, but manageable in terms of the whole health service. So amount of admissions trending down the way, and amount of people in hospital levelling off and trending down the way as well. So in a sense, this slide here on hospitalisations makes this slide here on cases somewhat irrelevant. And the other one that makes it relevant, of course, is deaths, which have been going up slightly, as we'll see, but probably about flat at the moment. So healthcare-wise, situation in the UK is manageable, but of course we've got such a backlog, it would be great to just get on with it. There's such a backlog of, if you're in the UK now, I mean, it's almost certain you'll know someone, a relative, parent perhaps, waiting for some elective surgery or some procedure, because there's so many backlogs with the health service because of the COVID problems. Now, UK vaccine report, antibody testing of blood donors, probably slightly overrepresented, but 96.2% in blood donors, antibodies, pretty good. I mean, that is actually quite impressive. 96.2% of blood donors. Of course, these are adults, they're interested in health, so the overall population number will be less than that, but nevertheless, that's good. Now, I'm not quite sure how they work this out, but this proper official government report said that 16.4% of these are from infections. So the vast majority of these this immunity, or this presence of antibody, shall we say, is as a result of vaccination. No question about that. Vaccines has prevented 21.3 to 22.9 million infections, fairly accurate, and or so they say, and 57,500 to 62,700 deaths. So evidence that that's working. Now, Dr. Claire Steeves, speaking for the Zoe app, says the vaccine is running out of places to go. In other words, the Tim Spector, Dr. Claire Steeves group is basically saying that herd immunity is developing, which is remarkably encouraging. Now, if we look at the COVID symptom tracker data, we do see that the cases are going down. That's the prevalence, 722,000. Number of new cases, 44. These are symptomatic cases, of course. Probably more representative than the government cases at the moment, which are officially diagnosed through testing. And although it's lateral flow and PCR tests at the moment. And here we see the prevalence definitely on a downward trend now there from the COVID symptom data. And what Dr. Steeves has said is that there's basically, this downward trend is confirmed by the ONS data, it's confirmed by the official government testing data, and it's confirmed by the COVID symptom tracker data. So it does look like it's fairly sure that cases are going down now, and as we saw, hospitalisations are going down gradually as well. Having said that, we've had more official cases diagnosed in the past couple of days. She also says that surge testing has been reduced in the UK. So if there's less surge testing, that means that these official number of cases here are going to appear lower. So that they will appear lower. So part of the reduction that we've seen in these official cases, when we haven't seen an equivalent reduction in the Zoe symptom tracker data, is probably because of reduced testing, whereas because people are reporting in, about 1 million people are reporting in their symptoms on the COVID symptom tracker data, that's probably more accurate. But it's also showing a reduction, which is the encouraging point. So all quite pleasing, really. If slow, hasn't gone away, no cause for complacency. The reason that it stayed relatively low is because people are still moderating their behaviour, and we need to do that for another month or two. But 96% antibodies in blood donors really is quite impressive. But of course, we need more than antibodies to protect us fully against the Delta variant. We need 2 doses of vaccine. So it's still got a bit to go, quite a bit to go, especially younger people who aren't as well vaccinated as older people. Russia, what is going on? Well, certainly cases are going up in Russia. I mean, basically the Russian people have somewhat taken their eye off the ball and behaving almost as if things are normal, but cases are going up. That's probably not a genuine reduction there. We probably are kind of at that kind of level in Russia at the moment. Fully vaccinated QR code needed for many venues. And now Putin introduces vaccine mandates for some jobs. President Putin officials, doctors, teachers, restaurateurs. It's now being mandated. And the problem here in Russia just seems to be simple mistrust of the government. The vaccine, from the phase 3 clinical trial data we have, appears to be very acceptable. Efficacy is good. But the Russian authorities, of course, put it through before the phase 3 trial data was finished. A lot of public mistrust. Great opportunity squandered there in Russia, and there's a general mistrust of government. But the data we have on the vaccine from the clinical trials does appear to be good. But pity that it's needed to be mandated in Russia now rather than getting the people to move with you. But rates of vaccination are going up, but largely, as we've said, because it's being mandated now in many sectors. China's got a resurgence of the Delta variant, maybe more on that soon. But President Xi Jinping pledged a further 1.3 billion doses of vaccine this year for export. At the moment, there is debate over the efficacy of the China vaccine. Places like Chile are looking to give a booster dose. China itself is trying to acquire mRNA vaccines or mRNA vaccine technology, but it doesn't alter the fact that the Chinese are exporting to COVAX more vaccines than any other country at the moment. And the Chinese vaccine is certainly, we believe, in terms of efficacy, a lot better than nothing. South Africa, as we saw in the original graph, Johnson & Johnson trial, Glenda Gray, Johnson & Johnson trial supervisor for, or lead researcher for South Africa, Janssen vaccine, of course. We